Hi everyone, I'm a medical engineer and I want to introduce you to the world of medical engineering. I live in Iran and for many reasons there are many difficulties in this field, but this is not the subject of our discussion today. So stay tuned for the video to introduce this field to you. If you like this video model, don't forget to subscribe. Biomedical engineering consists of biological science and engineering science to help people's health. Medical engineers work in various fields such as study and research, design, production, and repair. Medical equipment helps doctors diagnose and treat diseases and make it easier for people to access health. Many studies are done to produce medical equipment. Medical engineers, with the help of biological science, engineering, physics, mathematics, chemistry, and etc., try to design various equipment and correct the equipment that don't function properly for any reason. A medical engineer must be able to solve various problems in a short amount of time. Each medical device must meet different standards for operation, so medical engineers must carefully and meticulously review the various standards and apply them in the design and production of the equipment. Career paths in biomedical engineering tend to be driven by the interest of the individual. The huge birth of the field allows biomedical engineers to develop specialists in an area that interests them, be it biomaterials, neuromodulation device, orthopedic repair, or even stem cell engineering. Biomedical engineers often combine an aptitude for problem solving and technical know-how with focused study in medicine, healthcare, and helping others. It's this hybridization that has led to so much innovation and so much opportunity in biomedical engineering. The future of biomedical engineering. Revolutionary advances in medical imaging and medical diagnostic are changing the way medicine is practiced. New medical advances rising in the research laboratories of biomedical engineers around the world have completely altered the manner by which disease and trauma is dealt with by physicians, extending the quality and length of human life. Ultimately, the future of biomedical engineering is tied to both the issues and obstacles we discover and advances and achievements in fields like chemistry, material science, and biology. Just as in most other fields, interdisciplinarity means that innovation originates from many directions at the same time. If you like this video, don't forget to subscribe.